Thank you, Dr. Sudak, for speaking to simple and practical mental health. I want to start by asking, in today's day and age when we have less time with our patients and, for those psychiatrists and nurse practitioners who are not seeing patients every week, what is the role of cognitive therapy for this kind of situation?
Well, I actually think that one of the cool things about CBT is that it is very akin to psychopharmacology in that both of them are empirically based, both of them are seeking symptom relief, and both often complement one another in terms of helping patients. And so, from my point of view, part of my role as a psychiatrist, whether I'm seeing somebody in a 15-minute session or a 45-minute session, is to try to figure out what are the things that I can do that would most likely help that person in the next week. And so, from my standpoint, one of the things that often is lacking when I'm doing just psychopharm is that there's sometimes a time lag. And sometimes I can't provide as quickly the kind of relief that I would like with medication, or I could really jumpstart their recovery with some of the tools from CBT. So I think it has a real place in sort of providing an additive kind of effect. And there are many interventions that you can do even in a relatively brief period of time. The second thing I think is that many people who have chronic psychiatric illnesses are often really deficient in certain skills.
Yeah.
And those skills can be really important to impart to them even when they've been stable on medication. So there's that piece that I think we have to offer in terms of managing treatment. And finally, there's this really big wealth of literature about adherence work. We know that non-adherence is this enormous problem.
Right.
Lots and lots of people don't take their psychotropics.
Yeah.
Some don't even fill their prescriptions, particularly in primary care. And one thing that I think CBT really does a great job with is to provide people with tools for how to manage that, even insofar as the questions that they ask and how they approach patients about the problem with adherence. So I think it really has lots and lots to add. There's never really been any particular study about how long a therapy session really needs to be, right? We don't really know empirically about that. We do know that some therapy sessions need to actually be longer, like when we do exposure, for example. Those sessions need to be 90 minutes long sometimes. But it seems to me that once you have real knowledge base about how to go about doing this, then even in a short period of time, if you think about setting up a framework and either measuring one thing or changing one thing or teaching one thing, even in that short time frame from a conceptual point of view, you can really add value to the briefest of sessions.
So what about like if we are seeing a patient, let's say for a 20-minute, what they call a med check.
Yeah.
I hate that term. A short follow-up visit, a 20-minute visit, maybe you need 10 minutes to review the medications and so on. Is there something we can do in 10 minutes, or is that too little?
Oh no, there are certainly things you can do in 10 minutes. First of all, one of the things to think about is just structuring the session so that that can happen. So for example, one thing that I will do with my shorter sessions, I don't call them med checks, but I get it, is that I will have people complete diagnostic symptom checklists before they come in, so that when they walk into the office, I already have a piece of paper that lets me know sort of where the trouble spots might be or how things are from one session to the next.
Saves time.
So it saves time, and it really makes me much more efficient in terms of what to zero in on. And then I would say, well, what are we going to work on today? One thing we would work on is checking in about the medication. And so we would take X number of minutes for that. And then ask the patient, is there a particular thing in this session that we might be able to help troubleshoot to help your week be better? Or one or two things that might improve your mood. So for example, if I'm looking at a depressed patient, I might look at potentially, are there one or two things we could talk about you're doing in the next week that might improve your mood? So most of the time, part of what that would take from me is thinking about in advance the kinds of things that I might implement within a session with a patient that might have a really high value in potentially getting their symptoms to budge or to change.